Discussing calcium score is Heart Center cardiologist Dr. Simon Gorwara. Dr. Gorwara, what is calcium score and what does a score mean?
A calcium score is a test that allows us to pick up the development of plaque in your arteries at a very early stage. It is a CAT scan machine that allows us to get a score that determines what your risk is of a future heart attack. It's a very valuable tool that we have in helping us decide what the best treatment is for you as a patient.
If I have an elevated score, what do I need to do?
Well, part of that depends on how elevated your score is, and it also depends on what your other risk factors are. But in essence, an elevated score means that you do have some plaque buildup in your coronary arteries. And we want to start treatment for that and prevent future complications as soon as possible. Usually that may require treatment with medications that will lower your cholesterol, as well as medications to prevent clots from forming.
My score isn't that elevated, but my doctor is still treating me aggressively. Is that appropriate?
It probably is appropriate because an elevated score, even if it's not that high, does mean that there is plaque building up in your arteries. We still want to prevent complications and start treatment as soon as possible so that later on we're not dealing with a bigger problem.
Who should and should not get a calcium score?
The best use of a calcium score is in somebody who's at intermediate risk for heart disease. That means somebody who may have some risk factors but does not clearly have evidence of heart disease at this time. It's not ideally used for patients who are already having symptoms.
What's actually involved with getting a calcium score?
A calcium score is a completely painless, non-invasive test that uses a CT scanner that obtains images of your heart within a few seconds. The entire test takes less than 15 minutes and you get the score immediately.